It's a video station, probably the recall. Neonate congenital heart disease, supposed to this neonate sudden collapse. So in the video, I can say a 2 days old child uh, intubated, and there is non-dysmorphic face, well grown. However, I want to do the anthropometry, and there is IV cannula oxygen saturation monitor in situ, and umbilical catheterization done. And there is some birthmark present over the legs, and a pulse oxygen monitor shows that oxygen saturation is low, around 44%. So considering all, my diagnosis is ductus dependent congenital cyanotic heart disease, metabolic disorder, sepsis, neonatal congenital pneumonia, persistent pulmonary hypertension, and others cause methemoglobinemia. And history, so onset, course, is it progressive, course of the disease progressive or not, feeding history, what about the fever, daily activity, sleep, detailed perinatal history, and the child is apparently well grown and appears to be weight is more. So is there any history of maternal diabetes mellitus, and APGAR score and family history of any congenital heart disease, consanguinity, and sudden infant death present or not. And on examination, airway, breathing, circulation, vital signs, and pre and postductal oxygen saturation, forelimb, blood pressure, or any dysmorphic face present or not. And systemic examination, emphasis on the cardiovascular system examination, respiratory system examination, and investigation, imaging, chest x-ray for the cardiac size, pulmonary vessel size, echocardiography, for the detection of the defect, size of the site and the size of the defect, and blood gas including lactate, blood pressure in the upper and the right upper and the right lower limb. If the difference is more than 20, so it's significant. And to exclude other cause, CBC, septic screening, metabolic panel, and modified hyperoxia test with the consultation of consultant. And after investigation, now the management. So if it is we have to involve the consultant immediately, and immediate management is opening of the duct by prostaglandin, and urgent referral to the local cardiac center, and contact with the transport team. So during the monitoring, following prostaglandin infusion, this is the vital sign, and ABG to avoid acidosis, and pulse oximetry. Complication following prostaglandin: apnea, hypotension, tachycardia, hypoglycemia, fever. Thank you.